Hello, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center here in Rocky Mount. And this show is for you, by you, and about you. It's a community service sponsored program by WHIG TV, and they are passionate about keeping our community informed, anywhere from politics to health to funeral homes to the best pies, the best peaches, whatever. So I'm just part of a great team, and I'm glad to be here. I've done this for several years now, about 8 or 9. I'm not sure exactly how long, a while. Started when they were over at the in the Power Building where Chico's is, and we were there for several years, and now we've been here for several years. We're located on the Wesleyan University's campus. And so it's just really been a lot of fun to do this show, to be part of this organization, to have the recognition of knowing that I'm a WHIG employee, albeit a very minute one hour a week. But I do love it, and I do love talking to people about good health. I'm a big proponent on taking care of yourself. The doctor can do so much, but you have got to do your own self-care as well, as far as eating right, taking your medicine when you should, stop smoking if you smoke, don't drink very much alcohol. A little glass of wine or a cocktail before dinner is fine, but we don't want to drink to excess. So there's just so much that we can do. We've got to move. Our bodies are built to move, and we have got to move on a regular basis, on a daily basis. My Fitbit broke, and I'm debating whether to buy a new Fitbit or get one of those Apple Watches, and I don't know that I want one of those Apple Watches. I'm connected enough to the world without having it on my wrist as well. So I may just get another Fitbit. I don't know. But I did like tracking my steps. I would set it at 6,000 because when I work at the office 4 days a week at Family Medical Center. And I don't walk very much. I go from one exam room to another, to my desk, to another. It's just a few steps in between. When it's not, 100 degrees outside, I try to walk some in the afternoon in my lunch hour. Sometimes I just walk around in the parking lot. Sometimes I'll walk across the street to El Tap and get something for lunch. Sometimes I just take a walk. I like to walk. But I set my steps at 6,000, and 10,000 I think is a good goal. When I'm not at work and I'm home and I walk up and down my property, I go down to the goat pen and let the dogs out. I walk up to the chicken pen and feed the chickens and walk to the garden. So I put in a lot more steps, and I can hit my 10,000 on the days that I am home. But it's hard for me to do on the days that I'm at work, and we're all that way. When you've got a commitment to an employer for 8 or 10 hours a day, that has to be the first thing that we do. So anyway, those are kind of things in a nutshell. So tonight I was going to talk about a synthetic antiviral for COVID. It's called Paxlovid. I'm sure you've heard of it. I have prescribed it a couple of times. The last lady I prescribed it to, who actually works at this station, she got a rebound effect, which is something that happens with this Paxlovid, that you take it, you feel pretty good, and then boom, you've got it again. So I'm trying to think of what the exact term is. It's in here someplace. And so between that and a rebound effect, yeah. So between that and there's a list of medicines that you can't be on if you are going to take this Paxlovid. So I don't think it's as safe as they are telling us. I think, it was an emergency treatment. The drug was granted an emergency use authorization by the Food and Drug Administration in last December. And, I know that we all want to have something that we can take and not get COVID. I get that. I don't want COVID. I know. But there's something about some tried and true drugs too, and normally drugs take years sometimes to go through, and it's a very rigorous approach. And I'm not saying the FDA wasn't rigorous in that. That's not what I'm saying. It makes me nervous, and I've been this way not only about Paxlovid, but I've been this way for the last 10 years at Family Medical. When you come out with the newest and the greatest drug for diabetes or high blood pressure, whatever the drug is for, and then 2 years later, it's pulled because they found this or that or the other. So I tend to stick with medicines that have been around, that we know are effective, that aren't going to, we might see different things with this drug that nobody anticipated for. And this whole COVID thing has been one big guessing game, and in my opinion, and I'm just a lowly nurse practitioner. I'm not the latest and the greatest and up on the latest evidence, but in my opinion, Paxlovid is questionable. It's being prescribed in our office. I have prescribed it myself. But let's just go over a couple of things about Paxlovid. So like I said, it was granted emergency use from the FDA in December of last year. And it is supposed to be for anybody that's 12 or older and weighs at least 88 pounds. And it's an oral antiviral pill which can be taken at home to keep high-risk patients from getting so sick they need to be hospitalized. So if you test positive for the coronavirus and a healthcare provider writes you a prescription, according to Pfizer and the manufacturers of Paxlovid, then you'll be able to stay home and you reduce your risk of hospitalization, which is all very good. Nobody wants to go to the hospital for COVID, although I think that the severe cases of COVID, in like what we had in the very beginning, these variants don't seem to be quite as deadly. They don't seem to be quite as strong, that we're able to fight the virus off more. I don't know if they're weaker viruses or what, or I don't know why it was so devastating to begin with, and it still is in certain cases. We're certainly not over, sorry, I'm having a flash here. We are certainly not over the COVID crisis, and it's going to keep going on. In my opinion, again, it's my opinion, it's going to be like the flu. We're going to see rises of it and lower down, and more rises of it and lowering down again. That's kind of the way I think about it. So let's get back to Paxlovid. So the drug was developed by Pfizer, and according to Pfizer, it has an 89% reduction in the risk of hospitalization and death in the clinical trial that was supported. A number was too high to prompt the National Institutes of Health to prioritize it over the other COVID-19 treatments. It's cheaper than many other COVID-19 drugs, and it's provided free by the U.S. government while there is a public health emergency, and I don't know if that's still going on or not. According to Dr. Scott Roberts, a Yale Medicine infectious disease specialist, he thinks this is the beginning of a game changer for this COVID and these variants. It's really our first efficacious oral antiviral pill for this virus. It shows clear benefit, and it can prevent hospitalization and death in people who are sick and at risk. Paxlovid is the brand name, and it's made up of two generic medicines, nirmatrelvir and ritonavir. And anything that ends in a VIR is an antiviral. And some of these medicines, and maybe both of them, are also used for HIV, for treatment for HIV. And this is considered an improvement over treatments like remdesivir, which is administered IV. See, these are pills versus getting an IV infusion, and I certainly agree with that. So how does Paxlovid work? It's an antiviral therapy that consists of 2 separate medicines packaged together. When you take your 3-pill dose, 2 of those pills will be nirmatrelvir, which inhibits the key enzyme that the COVID virus requires in order to make a functional virus particle. After that treatment, the COVID virus then is released from the cells, is no longer able to enter uninfected cells in the body, which in turn stops the infection. The other is ritonavir, a drug that was once used to treat HIV but is now used to boost levels of antiviral medicines. As a COVID-19 treatment, ritonavir essentially shuts down the nirmatrelvir's metabolism in the liver so that it doesn't move out of your body as quickly, which means it can work longer, and giving it a boost to help fight the infection. Well, we don't like anything to move in and out of our liver. Of course, we have lots of medicines that do, lots of foods that do, lots of other things that do, alcohol. Our liver is our cleansing system, so anything that goes through the blood in the bloodstream is going through the liver, and the liver is going to take out the junk and send it out as waste, and is going to keep the important nutrients and whatever to feed our body and to keep our bodies going. So you have to take Paxlovid within 5 days of developing symptoms. So if you have symptoms and you test positive, then you need to call your doctor right away and say, I want the Paxlovid. Be up to that doctor whether he or she just prescribes it or not. And according to Jeffrey Topol, MD, a Yale Medicine infectious disease specialist, the earlier you take it, the more effective it will be. How often do you take the Paxlovid? You take 3 pills twice a day for 5 days for a full course. That adds up to 30 pills. It helps the pills packaged in a dose card, basically a medication blister pack that allows you to punch out the pills as needed. So is Paxlovid similar to Tamiflu? Dr. Roberts says it's a good comparison. Tamiflu is also an antiviral drug that reduces flu symptoms. Now, Tamiflu does not cure the flu. What it does is it shortens the duration of the flu. Both are prescription-only oral antiviral pills, and they are suggested to be taken early in illness. Tamiflu is taken twice a day for 5 days, and it must be started within 48 hours of the flu onset. So it's kind of hard to get that going that early. You know, for the first day or two, you might not even realize you have the flu yet. So, you know, there's the pros and cons of everything. And Paxlovid is authorized for people 12 and older and at least 88 pounds. I think I said that. But in order to qualify for the prescription, you must also have a positive COVID-19 test result and must be at a high risk for developing COVID-19. That means you either must have a certain underlying condition such as cancer, diabetes, obesity, or be of 65 years or older. And according to this article, more than 81% of COVID deaths occur in this group. The more underlying medical conditions a person has, the higher risk of their developing a severe case of COVID-19. The hope is that the restriction on one who can take Paxlovid will be relaxed over time, and that more and more people will be able to get the drug. So how does it work against the Omicron? Of course, we're already past the Omicron, and I think the latest one is like the BA1 or the BA2. I don't even know if it's around here yet. I can say that in our office, a lot of sinus infections, a lot of colds, a lot of stuffy heads, snotty noses, bad coughs, and I had 2 positive COVIDs last week. I haven't had one positive yet this week. So I don't know how, it's so hard to determine because, viral illness constitutes lots of different things. It's not just COVID. It could be a sinus infection. It can be the common cold. It can be laryngitis. So it's hard to tell. And of course, antibiotics are not going to touch a viral infection. It's a virus, so you need an antiviral for that. But some of the side effects of Paxlovid are altered or impaired sense of taste. Well, we're already getting that from COVID. Diarrhea, increased blood pressure, and muscle aches. So especially the increased blood pressure, you want to really worry about that. So let's talk about this rebound effect right quick. There have been reports of rebound of COVID-19 symptoms, and one of my patients did have this. And they've completed the 5-day course, and in those cases, symptoms have reoccurred 4 or 5 days after completing the treatment. My patient never became negative for COVID. It took her about 12 days to get negative from COVID, even after the Paxlovid. And in June, the CDC released a guidance for clinicians saying a brief return of symptoms may be part of the natural history of the SARS-CoV-2 infection in some people, independent of treatment. So there's just no evidence that additional treatment is needed. The hypothesis is the immune system didn't have a chance to see the full extent of the virus since Paxlovid suppressed replication early in the disease. Dr. Roberts says scientists are studying the effects of longer treatment durations with longer periods of isolation and other ways of managing the problem. And anyone who experiences a rebound, Pfizer recommends reporting it to them on its portal for adverse events associated with Paxlovid. And that's important because if more and more get it and more are getting the rebound effect than others, then they're going to have to relook at it and maybe adjust some. I don't know. So do you need to be up to date on your vaccinations if Paxlovid is available? And according to this article, vaccination is still a vital part of prevention. And this particular physician from Yale says that yes, you should have your vaccinations up to date and your boosters up to date. So that's kind of it. I'll look over my other paperwork on Paxlovid, but I think we've kind of hit all that. So when we come back, we're going to talk about another tongue twister. I'm just not good with these big old words. And it's called hypochlorous acid. And that's a natural antiviral. So we're going to talk about that when I come back. So don't go away. We'll be right back with more of Here's to Your Good Health. Hang on.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome. This is Here's to Your Good Health. I am Linda Prezioso, and we are talking about antivirals for treating COVID, and we've talked about Paxlovid, which is a prescription medicine that was made by Pfizer. You know, we have a Pfizer right here in our town. I don't think this Pfizer made that medicine. I'm not sure where it was manufactured, but you know, we'd like to keep our businesses here in our town working and keeping money in our economy. So you know, we like to do that. So I'm going to go into the hydrochlorous acid, hypochlorous acid. And we're going to talk about that a little bit. Now this is, it's an acid that it's actually produced in our bodies through a process called electrolysis. And it's a technique that uses a direct electric current to drive an otherwise non-spontaneous chemical reaction. Specifically engineered electrolysis cells can generate a solution of free chlorine species by running electricity through table salt and water. The oxidants hypochlorous acid HOCl and hypochlorite OCl are formed at the anode. If the pH of the solution is weakly acidic to neutral, the free chlorine solution will be dominated by the hypochlorous acid. Now, isn't that a big whole bunch of chemical stuff? But hypochlorous is a powerful oxidant and is 100 times more efficient at killing microbial pathogens than sodium hypochlorite, which is also known as chlorine bleach. So hypochlorous acid does not cause irritation to the eyes or the skin. If it were ingested, it causes no harm because it is so safe. It's the ideal sanitizer for direct food sanitation and food contact surfaces. It's also ideal in healthcare when it's used for wound cleansing, eye drops, and patient room disinfectant. And you know, the use of chlorine disinfectant has been researched for 100 years. It has been an undisputable fact that hypochlorous acid offers far superior disinfecting properties than chlorine bleach. One of the most well-known authorities for the use of chlorine as a disinfectant is White's Handbook of Chlorination. And this book is a comprehensive detail explaining the chemistry and the effectiveness of chlorine and alternative disinfectants. But we're not going to do all that. What I wanted to get to with this is that it has now been, and maybe this is a little bit too, we don't want all the physiology and all that. That's just way over my head. I did chemistry once. I don't want to have to do it again. So let me move on past this paperwork and we'll move into another one. There has been a gentleman, I do not remember his name. I can try look it up on my phone. But he figured out a way to make this and keep it so it's got a shelf life, so to speak. And he has made products, and you can look at these products. I mean, I've Googled it several times. There's multiple products that we buy every day, and I've got that in here someplace, and we'll talk about it. But he figured out how to kind of rein it in, so to speak, how to make it so that he could keep a shelf life. And he has made both a body spray and a nasal spray. And after I've been reading this, you know, my husband and I are going to Hawaii in September. It's been a lifelong dream of ours. We've dreamt about it for 40 years. It's the only state that my husband has not been in. He's been in 49 states. And so that's a goal for him to say he's been to all 40 states. And so, you know, if you have COVID, and a lot of times you can have COVID and you don't even know it, but you'll test positive. That happened to a friend of mine. She was supposed to go on a cruise. She tested positive and you couldn't go on the cruise. Well, you know, we've got to be able to test positive 2 days before we get on that cruise ship. So I think I leave Friday morning, so Thursday I've got to get a COVID test that's negative. I'm saying all that to say this. I don't want to have some freaky thing happen and I test positive because of where I work, or you know, for somebody coughs in my face or whatever. So I'm going to be buying this stuff. I'm going to get the nasal spray, and my husband and I are going to do that nasal spray every day for the month prior to us going on our trip, and while we're on our trip, because we'll be on a cruise ship, and you know, things seem to spread like wildfire on those cruise ships. So that's why I started learning about this. I heard it on a podcast, and so I started looking into it. And so it's great for skincare. You can use it for acne, and it's over the last year it's verified its power as a disinfectant against COVID-19. And so we're going to turn this article is written by Shilpi Katarpal, MD. He's a dermatologist. And so, hypochlorous acid exists in our bodies. It's created by white blood cells, a defense system against infection, bacterial, and general ickiness. Now, I used to say ick as a kid in Minnesota. I don't know if that's a Midwest term. I don't hear too many people say icky or ish. But anyway, he says general ickiness. And I just found that was kind of interesting. And the hypochlorous acid attacks invading pathogens, breaking down the cell walls before destroying unhealthy invaders. The antimicrobial acid is lethally effective in carrying out its protective mission. And he says, think of it as your own internal Batman. It's your body's natural response to bacteria and to viruses, and it's very effective at its job. So how does it end up being mass-produced for cleaning supplies and skincare products? Well, chemists long ago cracked the code to make hypochlorous acid by using electrolysis to break down a simple saltwater solution. More recently, however, manufacturing advancements have allowed hypochlorous acid to be made in larger quantities with longer shelf life, which is a key to more widespread use. That's where I'm going to be able to get, that's why I'm going to be able to get the nasal spray for my trip. And skin is an incredibly tough and durable. It's our largest organ. It's our biggest protective organ of our body. And it's a necessity. Its role is an outer barrier that protects our inner workings. The frontline role, however, leaves your skin vulnerable to cuts, scrapes, and all the bad stuff that's working to keep it out. This doctor says that hypochlorous acid offers your besieged skin a little backup by working to fight bacteria that causes clogged pores and acne, so it's great for acne. Speed up wound healing and repair damage. Combat inflammation such as eczema or psoriasis. The best part of it all, though, this hypochlorous acid is totally non-toxic. It handles this hard work while being incredibly mild to your skin. And that gentleness is a byproduct of it being naturally produced in your body's immune system. It's great for sensitive skin. It's not going to give you the dryness, burning, or irritation of other products. And most like our hand lotions and body butters and all that, their base is alcohol, which is a very drying agent. When it comes to at-home use, hypochlorous acid typically delivers its benefits by the squirt. That's why we have the spray. Sprays feature the cleaning agent are widely available. Most are marketed for use on your face with a focus treating acne, eczema, and psoriasis. It can also be found in creams and serums, and it can be incorporated into a daily skin maintenance to remove bacteria. And the sprays can be used as a quick hit on-the-go defense against COVID-19. Hypochlorous is not a substitute for basic washing and scrubbing, though. Think of it more as an extra line of defense. So, are there any dangers by using the hypochlorous acid? Its billed as being 100 times more powerful than bleach when it comes to fighting bacteria. So knowing that, do you really feel comfortable putting it on your skin, over your face, and without worrying about your skin? And this dermatologist said there really isn't a risk. It is safe. Dr. Catarpal advises that you make sure to verify a product with the hypochlorous acid that it's billed for skincare before using it on yourself. And if you have any kind of sensitive skin, you should stay away from any hypochlorous acid that has fragrances. And that's the problem. We have these great lotions and these great perfumes, and then they put in, I like essential oils because they have a nice scent and they're natural. But you put in all these fragrances, and then we develop rashes and we develop allergies to these fragrances. So that's one of the articles I had on this hypochlorous acid. I just find it very fascinating that our body makes it. They've figured out how to mass market it so it can be either a nasal spray or it can be a body spray. And what the podcast that I listened to, this gentleman has used it throughout the entire COVID thing. He's used it, his family's used it. They don't wear masks, they go out where they want to go, and not one of them has had COVID. So there's something to be said for that. So it's almost time for our next break. So we'll go ahead and do that, and then I'm going to talk about the hypochlorous acid a little bit more. And then I'm going to try and look up that website so you can order some for yourself if you feel led, or you can go and look online for it. So we'll take our next break, and then we'll come back and we'll talk more. Don't go away. See you then.
Come celebrate our 20th anniversary with us and see how we can help with your hearing challenges and hearing care. To celebrate this monumental occasion, when you buy a pair of Livio 1600 series hearing aids or higher, you get one hearing aid for free because it helps to have a spare of equal or lesser value. We know how inconvenient it is to have your hearing aids serviced, maintained, and repaired without a spare. As a community provider, we are focused on individualized care as personalized as your fingerprint. We build relationships with our patients and believe that is the only way to provide the quality of service that has kept us in business for more than 20 years. We have grown and stood the test of time while embracing technological advances and innovations in our industry. We couldn't do it without all of you.
You don't know what anybody can do for you until you have a problem. And when you have a problem, is how the person works through that problem that makes them effective, makes them beneficial in your life. I get involved in a lot of activities at our church. And with the music and things that are going on, I'm going to my noisy setting quite a few times, and then depending upon who's speaking, I may be going to what they call a theater setting, which is a higher level, and so you have to negotiate. You only have, in my case, I only have like 3 different levels now. She does have some technology. We have some different volume controls. I don't use that, and I have to work with her, and rather than having to come back to the office, it's easier for me to call her wherever she's at, and we'll set us up a time, and then she will readjust my hearing aids over the telephone, which works real good. And I've used that quite frequently. But usually once you get set up, you don't typically have to change much. And a lot of times people don't want to go through the pain of the setup process, but if you don't spend the time in the setup process, you're not going to have the long-term results.
We are thankful to our faithful customers and look forward to many more years of service to our community.
I would say patients, they say it for us. You know, they refer people to us all the time, and they're not going to refer if they're not happy with you. If they don't think you're going to take care of their friend or their family member, they're going to shut right up. They're not going to say anything. And I've built my business on 75% referrals.
We offer convenient financing, layaway, and many pay options to ensure that our customers have comfortable experience getting quality equipment, reliable service you can depend on, and the product that fits both your physical and financial needs. Please visit our website, downeasthearingcare.com. Don't miss out. Schedule your appointment today. This month, we would like to invite you to our VIP 20th Anniversary Open House Hearing Healthcare event. During this event, we are offering 1 free Livio RIC hearing aid with the purchase of 2 Livio MRIC devices per person. Receive an expert, no-obligation hearing consultation and free product demonstration. This limited-time offer is available at our local hearing clinics. Get answers to all hearing-related questions. You can reach our convenient locations in Knightdale at 919-500-7455 or Rocky Mount at 252-378-2018.
All right, I'm back. Hey, everybody. I forgot to look up that that website, so I will. I'll look it up in a minute. I'm sorry. I got waylaid to do something else. So. This article was published for to look at the hypochlorous acid as a inexpensive, available, non-toxic, and practical disinfectant that is effective in I'm losing my mind. I can't think. Is effective against COVID-19. Sorry. I'm sleep deprived, y'all. I haven't been sleeping. So when you go to bed tonight, say a prayer. Let Linda sleep. I wake up 3 and 4 and 5 times a night. And sometimes I can go back to sleep and sometimes I can't. I get up at 3 in the morning. I'm up till 4:30, then I sleep for an hour and my alarm goes off at 5:30. So my brain is just not cooking with gas. And at my age, you need all the gas you can get. You know what I'm saying to you. So anyway, this article was written to see if it was effective against COVID-19. And as we know, COVID-19 is a novel virus, new. It causes severe acute respiratory syndrome, and it started with SARS. You know, we had SARS years ago in China. And it's the agent responsible for a surface-to-surface communicable disease that has infected approximately 4.7 million people as of May 2020. And healthcare providers need options to limit and control the spread of the virus between themselves and the patients. COVID-19 is an enveloped, positive sense, single-stranded RNA virus, approximately 60 to 140 nanomillers in diameter, and that's really little. The virus's spike glycoprotein S1 firmly binds to the angiotensin-converting enzyme receptor, which allows entry into the host cell. COVID-19 infection creates a cytokine storm, severe pneumonia, multiple organ failure, and acute cardiac injury. And we know all of that. We've seen and heard all of that over the last few years of COVID. Transmission occurs through touch or aerosol. Aerosol meaning you sneeze and your particles go out into the air, and that spreads the virus. A common pathway of spreading the virus is through respiratory aerosols from an infected person. During speech, humans emit thousands of oral fluid droplets per second that can remain airborne for 8 to 14 minutes. COVID-19 is detectable up to 3 hours in surface aerosols, up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic, stainless steel. And there has not been a good disinfectant to stop COVID-19 transmission. I'm not going to go into all that. But anyway, on to hypochlorous acid. An ideal disinfectant and sanitizer must be non-toxic to surface contact, non-corrosive, effective in various forms, and relatively inexpensive. Hypochlorous acid may be the disinfectant of choice for the coronavirus and oral maxillofacial surgery, and that's really what this is about, is using it in that particular surgery. And maxillofacial is anywhere, here. It's an indigenous substance in all mammals, and it is effective against a broad range of microorganisms. Neutrophils, eosinophils, mononuclear phagocytes, and lymphocytes, those are all part of our blood system. And they produce this hypochlorous acid in response to injury and infection through mitochondrial membrane-bound enzyme known as respiratory burst nicotinamide adenine dinucleotide phosphate oxidase. I can hear my nurse laughing right now. She watches me every Wednesday. I don't know why, because she works with me all week. You'd think she was sick of me. But I can just hear her now laughing because I'm struggling over these big words. And I could practice them from now till next week, and I still wouldn't get them right. My Minnesota tongue doesn't go around all of those words with so many syllables and nouns, vowels in them. And so the hypochlorous acid selectively binds with an unsaturated lipid layer, lipid is fat, and subsequently disrupts cellular integrity. It's a powerful oxidizing solution. In aqueous solution, a liquid, it dissociates into hydrogen and I think it's it dissociates. It gives me a chemistry formula, but it denatures and aggregating proteins, and it destroys the viruses by chlorination, by forming chloramines and nitrogen-centered radicals, resulting in single as well as double-stranded DNA breaks, rendering the nucleic acid useless and the virus is harmless. So how do you make it? I mean, you and I can't make it. But it can be made on site combining iodinated salt, water, and electrolysis. The symptom can be made in a 1 liter container, which is filled with water, of which 1 gram of non-iodized salt and 1 teaspoon of vinegar are added. Maybe we can make it. That sounds kind of easy, doesn't it? The system has the ability to make concentrations of 50 to 200 parts per milliliter, and depending upon its use, when chosen by pressing a button on the instrument, the electrolyzed solution is completed in 8 minutes when it's ready for use. So I can see using this and figuring out, I don't think we should make it ourselves. I'm going to buy it. But I can see how we could use this on our bathroom surfaces, our kitchen surfaces, after we've cut up some raw chicken, get that and just spray away. If it doesn't smell good, we could put a drop or 2 of essential oils. There's several antiviral essential oils that we could add to that as well, just so it would maybe smell a little more pleasant. I don't know what it smells like because I haven't gotten any yet, but I'm sure going to try it and I'm sure going to use it. So I'm not going to go into all these solutions and the concentrations and all that. But this is the recommendations for office use, and I believe we can use it for home use as well. So individuals working in the dental and medical field using surgical and high-speed hand paces are at risk for aerosolization. Aerosols are defined as particles less than 50 grain in diameter. Particles of this size are small enough to stay airborne for an extended period before they settle on an environmental surface or enter your respiratory tract. A true aerosol or droplet nuclei may be presented in the air of the operatory, which is what they're talking about, the surgery center, up to 30 minutes after a procedure. So they want to spread all this stuff and keep surfaces clean and sterile. Ophthalmology uses hypochlorous acid in the treatment of blepharitis by reducing the bacterial load on the surface of the periocular skin. Blepharitis is an infection in your eye, and periocular is the skin around. Peri is around, and ocular is eye. So the skin around the eyes. 20 minutes after the application of the saline hygiene solution, concentration of hypochlorous acid at 100 parts per milliliter, there's a greater than 99% reduction in the staphylococcal load, which was achieved. That's a big reduction. It's also effective for cleaning biofilm contaminated implant surfaces. Let's see. It was well tolerated by oral tissues, significantly reduced bacteria on toothbrushes, and was effective as a mouthwash and for toothbrush disinfection. Wound care, in a clinical study on the intraperitoneal wound care, patients underwent lavage of the peritoneal cavity, that's your belly, inside of your belly. It's called the peritoneum, and there's a cavity there. Let's see, I lost my place here. And washing went under lavage of the peritoneal cavity and washing of the wound, and there were no adverse effects that were observed. It's also good for reducing wound bacterial counts in open wounds. You can irrigate the in an ultrasonic system, and it can lower bacterial counts 4 to 6% or more. By the time the definitive closure, the bacterial counts were back up, and so the solution had to be reapplied. Post-operative failure occurred in more than 80% of the patients that had a saline solution versus 25% of those with the hypochlorous acid. Hand sanitizing antiseptics are alcohol-based or non-alcohol based containing antibiotic compounds. Chlorine-based sanitizers are effective against bacteria and viruses, but hypochlorous acid is effective at a higher rate and a higher strength than the hand sanitizers. A study looked at disinfecting outpatient surgical centers. After cleaning the rooms in the hypochlorous acid cleaning and disinfection study arm had significantly lower bacterial counts than the rooms that underwent standard cleaning and disinfection. So you can apply it by spray or fogger. I'm not sure what a fogger is. I mean, I know what it appears to be in my brain, but I don't know what you use that for. But anyway, I guess they do. And the hypochlorous acid is a virucidal solution. It kills the viruses. So the pandemic has caused massive healthcare and economic disruptions across the world. The current unavailability of an effective antiviral drug, approved vaccine, means that the implementation of effective preventive measures are necessary to counteract the COVID-19. Oral maxillofacial surgeons are at high risk providing needed care to their patients, and this is really helping them to be able to give the best care to their patient and to keep them safe from the virus. This hypochlorous acid has been used in industries from farming to restaurants, regarding food to health care, chronic wound care, disinfection. And so there's just a multitude of places that it's been used, and it's been proven to be effective. So, it's one of the disinfectants when combined with adequate personal protective equipment, that's the PPE that all healthcare people have to wear, screening and social distances techniques, hand washing, and high volume evacuation may all help the reduction of the COVID-19. So it's inexpensive, it has a good safety record, and it's used to disinfect large areas quickly with broad range of bactericidal and virucidal, so it kills both bacteria and viruses. So I know that was kind of a mouthful, and some of it was a little bit over my head, so I'm pretty sure it was over your head, but I'm going to get some of it. Let me see, I got half a minute here. Let me see if I can find that. Oops, no, I'm not going to find it there. See if I can find where you can get it, because I think it's really worth looking at and going to get. Let's see. Well, it says it's in the Walmart Supercenter and the drugstore and the CVS. I don't know if it is, but there is several places online. You can get it off of Amazon. The place that I looked was called C as in cat, B as in boy, spray.com. cbspray.com. So check it out and see if you think especially if you've had COVID, you're like me, you're going to travel somewhere, you don't want to get COVID, whatever the case is, check it out. Let me know. Y'all have a good evening. Stay tuned for Randy. He's here and he's going to be talking about Way Back Wednesday. Yeah. And I don't know what he's going to talk about, but he's always got interesting subjects, and I love hearing all the history of Rocky Mountain. I didn't grow up here, so some people remember these places. I don't. I've been here for 36 years. That's a long time, isn't it? Longer than I lived in Minnesota. All right. It's time to say goodnight. I'll see you next week with more of Here's to Your Good Health. Good night. Stay safe and stay healthy.